conditions that were existing, but also lessons learned from the previous efforts. These are some of the goals to reduce the malaria mortality and morbidity by about 40% by 2020, and gradually increasing that percentages all the way to 2030. That the expectation was to have about 90% reduction in mortality and morbidity due to malaria. But also to eliminate malaria from a number of countries, and the target by 2030 was 35 countries, and to prevent the establishment of malaria in those countries that achieved the eradication. So this was a very important milestone in terms of the efforts to fight malaria, and the global technical strategy had 3 pillars. The first pillar was to ensure that there's universal access to malaria prevention, diagnosis and treatment, but also the second pillar called for accelerated efforts towards elimination and attainment of that malaria-free status. But also another key important pillar was to transform malaria surveillance into strategic intervention to inform the fight against malaria. And these were supported by the 2 supporting elements. The first one was to harness innovation and expanding research, and the second was to strengthen the enabling environment to enable the progress. Important to note is that there's no one-size-fits-all strategy. Each country was supposed to look at the strategy as a guidance and localize it, of course, based on their transmission intensity, as well as the epidemiological, ecological, and social characteristics to define how best they will proceed towards eradication of malaria. And it's important that they are adopted and tailored according to these countries. So this is important. And this is just a pictorial demonstration of how countries will proceed. Most of you might have read this already. So it showed between, from high intense transmission area all the way to very low. The approaches will vary depending on where you are, from identifying cases and treating them to really identifying the hotspot or focal area where malaria is to try and stamp it out. So the supporting elements, one of it is very important, and I want to speak a little bit about it, is harnessing innovation and expanding research. And this is an important aspect. It is, of course, we know that now we have tools that are able to really make a big impact in terms of malaria control and elimination. And there are countries that have eliminated malaria with the current tools we have. So scaling up of those tools, ensuring that they reach the people who need it the most, and deploying all the strategies that have been recommended, that by itself can give us success. However, we also know, and this has been alluded to by the CMO who was giving her opening speech, there are challenges with these tools, and hence we need to continue to either improve these tools in terms of how they are deployed, coming up with innovative approaches of deploying them or combining them, but also looking for new tools that would help us in the fight against malaria. So vector control, of course, there are challenges with this tool now, and we have to think about new tools that we need to deploy. And you will hear a little bit about some of the work Ifakara is doing towards that. Diagnostic testing and treatment. We need new diagnostic testing that can identify or detect malaria at a very low level, especially as you move towards elimination, but also we need effective treatments, and we are all aware of an impending threat on the current drugs that we use for malaria, with the emergence of partial resistance in some parts of Africa. So again, we really need to think about the best approaches of how to use the medication we have so that we can slow down the emergence of resistance, but also look for new tools that will help us sort of fight malaria. We have malaria vaccines. Again, this at the moment we have 2 malaria vaccines which have been recommended by WHO, and I think we need to use this so that we can complement all the existing tools. It is important to realize here the malaria vaccines are not meant to replace what we are currently doing, because all the evidence show that they work best if utilized together with insecticide-treated bed nets, for instance. So they are meant to build and not to replace, build upon and not to replace. And surveillance is key as well, as we need to look at how best we can use surveillance to inform the interventions we deploy and how we deploy them. But the integrated nature of malaria control, it teaches us or tells us, I think it's not a matter of having the tools itself, because yes, the tools are important, but if the entire system, the health system, is not strong enough, then we are still very prone to failing in terms of achieving our goals. So again, it's very important when we talk about this enabling environment to think about a number of things, being, strengthening our health system, making sure that we make efforts towards achieving a universal health coverage, but also look internally and look at the sort of domestic financing, which should also increase perhaps much further than international funding if we are to have a sustainable achievements. I think domestic financing is the key, and I think we will discuss this in today's panel, and we will hear from our expert on how to achieve that. But also strengthening the health workforce and build skills for malaria, train different cadres of healthcare workers how to manage malaria is also an important aspect, but also building the community. Again, our chief medical officers alluded to this, that malaria begins with every one of us. So I think building that sense of community engagement and empowerment, I think is very important to ensure that the people themselves take pride in participating in these efforts to fight malaria. But also it's important to really make sure that we reach to the individuals that are in hard to reach areas, and integrated community-based case management is one example of it, which is really trying to ensure that the people who need the care the most are reached, and we are able to have an impact in terms of stamping out malaria. But also broader determinants of malaria is important, and most of these things, most determinants not only affects malaria, but they also affects the overall health of the community. So we should look at these issues in more holistic manner, and not sort of focus on a single disease approach, but really looking at the entire community's well-being, health, and I think in that way, I think we will see that we can make more strides towards controlling, eliminating, and hopefully eradicating malaria. But also private sector participation is very, very key here. It's not the government or public sector alone. We need the involvement of public health sector, but also increasing government coordination and cross-border collaboration. These are all important things to consider. So countries have been making efforts. I think if we look at the malaria burden over the years, we have made progress. But I think, as was also alluded earlier on, that in the last few years we have stalled, and I think this is not very good. So we are seeing that malaria burden actually increasing in some of the area, in some countries not making progress toward this overall target of reaching, as I said, 90% reduction in mortality and morbidity due to malaria by 2030. So we are off track by almost 40% when it by 2020, and I think this calls for everybody involved in the fight against malaria to take a pause and really critically evaluate what we are doing right, what we are doing wrong, and where we need to put more efforts so that we can go back and stay on course. There are people thinking perhaps the goals were too ambitious, but I think it is important to really critically look at whether we've been able to meet the sort of scaling up targets that we're meant to achieve. So some of the countries are accounting for, well, these 11 countries plus India account for over 70% of the burden. So these are high burden, high impact countries, and I think for these countries it's very important that we stop doing sort of business as usual, but rather really take more efforts. As the CMO has said, we need to run and not walk, because we have a challenge in front of us, and if we work together, we are able to do that. And Tanzania is those countries as well. So I don't think it's a good place to be, but I think we should strive. This should be a motivation for us to increase our efforts. And Yaoundé Declaration, which took place a few months ago, sort of reaffirmed countries' commitment, especially those countries in the high burden, high impact, that we need to do more. We need to really come back to strengthen the political will, ensure that the strategic use of information for action, all these things have been recommended to be a pathway towards elimination and eventually eradication across the world. So providing better technical guidance, enhancing coordination of multi-sector action. Again, malaria is not only a health sector problem. All sectors must come together to attack malaria, but also strengthening the national system. Again, reaffirming the need to look at the global sort of universal health care approach to support the control, eradication, and elimination and eventually eradication of the malaria. But build the partnership and resource mobilization. This is again very key. And internal resource mobilization is critical if we want to achieve and permanently sort of sustain those achievements. And again, ensuring functional malaria accountability to monitor our progress and take action when we see that we are diverting from the goals that we have set to achieve. So with this, I would like to again say that this particular forum today will discuss a lot of issues that would all aim at sort of addressing some of these issues, but seeing how together, as the CMO has urged us to do, we can put our heads together and find a better way towards malaria elimination and eventually global malaria eradication. Thank you for listening.
Asante sana Dr. Ali Olotu, the Director of Science at Ifakala Health Institute. Naomba tuongeze makofi tafadhali. This was a 360 presentation. If you are a politician or a policymaker, you got your piece. If you are a scientist, you got your piece. If you're a journalist, you got your peace. And even if you're a community member, you got your peace. Makofi mengine tafadhali. I think we all heard that Tanzania is among the few countries that are contributing to over 70% of the burden of malaria. And we are contributing about 4% of malaria deaths. So, ni vizuri kwa maarufu, lakini kwa vitu vizuri. Sio vizuri kwa maarufu kwa kuchangia vitu vibaya. Kwa hiyo, I hope we will be able to get some solutions from this side. This session had no questions, but because of its importance, I allow 1 to 2 hands for any question for clarification. Kama kuna swali lolote la haraka, burning, any clarification that is needed from the presenter. Hakuna, safi. So the next we will be now going to hear from the country programs, malaria programs on the situation. But this session will be moderated by a well-known journalist, our brother Salim Kikeke. Salim is a journalist and a broadcaster who had worked for BBC for over 20 years, covering major news stories in Africa, including diseases. Now Salim is back in Tanzania and he works with the Crown Media. Karibu kwa Salim.
Good morning. It's so nice to be here. I am really honored to be invited, involved really with this project. I am always fascinated, I've always been fascinated with malaria, and I'm certain that each and every one of us in this room has their own personal experience when it comes to malaria. Just a quick one, how many of you have a mosquito net and they don't really bother using it at night? None? Come on. No, you're right there. But yeah, malaria is such a huge disease, and personally, having lived outside Tanzania for a long time, but growing up as an African child, of course, I had malaria when I was a kid, and when a few years ago actually, I was in London donating blood, and so after donating the pint of blood, I think, I had to fill some forms, and then one of the people in that center actually realized, because they asked me if I've ever had malaria, and I said yes, I did, but it's like over 20 years ago, and suddenly the whole center was tense. We have someone who had malaria. And maybe I'm exaggerating, but it did feel very good. And later on, they told me that they will not be using the blood that I had donated, and they will destroy it. And obviously, I was distraught. So when I do get involved in such projects, I really want to give it my best, and from a journalistic point of view, it does help me quite a lot to understand what is going on. If you look at the numbers, they're quite grim. I know they look encouraging. We've seen from Dr. Lotu and our chief guest as well. I keep asking myself, if our target is to eliminate malaria by 2030, with the pace that we're going, Are we going to hit the target? I don't know. We have to do a lot to achieve that. And I'm so glad that we have the main stakeholders here. We've seen from the report from Cameroon talking about the political will. And my question is, do we have the political will to quite achieve what we're doing? So, yeah, I don't want to talk too much. I think I'm only here to invite the speakers. And I would like also to have a few questions after the presentations from Tanzania mainland and Zanzibar. So we're going to go first with Dr. Samuel Lazaro, who's the program manager of NMCP. We'll hear from him, and then later on from Mr. Shija from Zamet from Zanzibar. And then we're going to have a chat at the back of that. Thank you.
Asante Kikeke. Good morning everyone once again. Habari za asubuhi. Yeah, I'll be taking you through the malaria burden updates from mainland Tanzania. Actually, I should say at this juncture that most of my presentation has been covered by the previous speakers, especially the Chief Medical Officer. However, for the sake of those who might not be able to hear what the Chief Medical Officer said, I will repeat that presentation and I will be clarifying more in some of the areas. So bear with me. I think you will. There is something that you'll gain from my addition. So those are the areas that I will be presenting. I will repeat the mission, the vision, mission and goal, and also I'll take you through the indicator performance, malaria certification, challenges, where I'll speak more, and then on the way forward. So this slide is quite common, but we keep repeating it because it makes a base of what we want to do. So our vision actually is to make sure that we have a nation which is malaria free. This is what we're doing. And the mission is actually to have equitable access to sustainable, quality, effective, safe, and affordable malaria preventive and curative services through efficient, collaborative partnership. And I just want to emphasize the community ownership. Whatever we want to do in malaria control and elimination, it has to be owned by the community, without which we'll be talking now and then without realizing our goals. So it is very important to make sure that the community understands what we want to deploy at that level. I just want to share with you, we have made a lot of achievements in terms of burden reduction in our country. And in malaria, if you see red color, means high malaria burden areas, and green, the lowest malaria burden areas. So these are the maps from 2018 to 2022. The situation in 2028 was like this. Much of the areas were having high malaria transmission risk. But if you look at the malaria certification map, you see much of the green colors. And the green colors here means that the incidence is less than 50 cases per 1,000 population. And the red color is over 200 cases per 1,000 population. So we are currently having over 41% of the population in mainland Tanzania living in very low malaria transmission risk, as compared to the previous 20 years where we had only around 4 to 5% of the population who lived in area where malaria transmission risk is very low. Again, as was said this morning by the Chief Medical Officer, in 2017, the malaria death per 100,000 population was around 7.2, and last year was 3.2. So generally, there is a downward trend in terms of mortality reduction. However, if you look from 2019, it was 3.6, which are almost the same for the past 5 years. The number of deaths are almost the same. So the key message that I want to communicate, yes, we've been doing fine. However, in the recent years, there is stagnation in terms of reducing the malaria-related death. As you all know, one size doesn't fit all. We have actually structured our country based on the malaria transmission risk, and we have 4 epidemiological strata. The very low, moderate, and high malaria burden areas. So we try to unpack to see which strata performs better. And this one is a strata where malaria transmission risk is very low. So if you look at this, you see the trend from 2015. The malaria prevalence is on the increase. It was 0.2 in 2015, but now it's around 0.6. This is the low malaria transmission strata. Again, it was 1.8 in 2015, and it is now, it was 1% in 2017, and it is now 0.4. However, if you look at the high burden areas, the reduction in terms of malaria prevalence has been very unstable. However, there is a downward trend, though the prevalence is not that stable. Again, if you look at the malaria prevalence, as the CMO said, in the past few years we are stagnated. Actually, we've increased by almost 0.6% from 2017 to 2022. Again, if I go back to this map, I just want you to concentrate on this dark color. These are the area with the highest malaria burden. This was in 2007. But if you look at the 2022 malaria indicator survey, we have been able to reduce the highest malaria prevalence in most of the areas. Actually, to date, we have no any region whose malaria prevalence is more than 25%. But back in 2007, we have several regions that had malaria prevalence of more than 25%. So we are generally doing fine, but we have to be cautious, especially the recent trend in terms of malaria burden reduction. We have 3 sentinel populations that we are following the trend of malaria burden. I just said about the prevalence, but we have been very closely following the malaria trend in school-aged children, and we started well back in 2015. And if you see the malaria prevalence in this age group, there is a downward trend, but suffice it to say, school-aged children are twice as much infected as compared to the under 5s. We are saying in 2022 the prevalence was 8.1, but in 2023 for school-aged children it is 11.3. So the school-aged children are much more infected compared to the under 5s. And the bad news for school-aged children, they are not sick, they are going to school, so they serve as a reservoir to the population if at all we will not take any measure to this age group. So we usually conduct the malaria parasitological survey, school malaria parasitological survey after every 2 years. We started, as I said, in 2015. You could see the prevalence was high. It was 21.6. However, if you unpack, you see that the malaria prevalence was higher in older children compared to the lower aged groups. but generally there is a downward trend. So the message here, those who are older than, the older children are more infected than the young ones. We also try to see of the school-age children that we researched, those who slept under items and those who did not. We generally saw that those who slept under the items, their malaria prevalence was lower than those who did not. For example, this was in 2015. You could see those who did not sleep under items, the prevalence was at this level. But the same year, for children who slept under items, the prevalence was relatively low. But you could see in all the years, those who used items, their malaria prevalence was a bit lower. However, this level is still too high, and the key message here is to make sure that one intervention is not enough. We need to integrate several interventions in order to realize the goal that we dream of malaria free by 2030. Another population that the other, what is it? The other sentinel population that we are following is the pregnant women. Actually, what we usually do, we screen our pregnant women for malaria every time they visit antenatal clinic. Actually, the first antenatal visit, we screen them for malaria. And this has been the trend of malaria prevalence in this sentinel population. And you could see the malaria prevalence in this population is almost the same throughout the years since we started. Yeah, and even if you look at these maps, actually it portrays the same. The malaria prevalence in pregnant women has almost been the same. So we are stagnated almost everywhere. This is the malaria certification. I just want to share with you that this is the malaria certification per region, and this is per council. If you see, in 2020, we had actually 7 regions whose malaria transmission risk was high, but this number of regions increased to 10 regions last year. Again, if you unpack to council level, there is slight decrease of councils with the high malaria burden. We had around 64 councils in 2020 with the high malaria burden, but we have been able to reduce to 57 councils. But the key message that I want to communicate here, despite the achievement that we are getting, but the pace is very slow to be able to eliminate malaria in 2030. So this one, maybe I should not repeat because it was very well said by the Chief Medical Officer, and it explains how far we reached from where we started in terms of reducing the number of cases, incidents, hospital admissions, death. So this one was very well said by the Chief Medical Officer. So if you were to ask me, actually, what is the key message that I want to communicate with this audience is around the challenge that we are currently facing. And actually, I was talking to my boss, Dr. Catherine, this morning that we should share this challenge because I believe through this forum, we'll be able to discuss, not only to get answers today, but it might be a topic or a subject matter for all of us so that when we meet next year, we might be having some answers to some of these challenges that we are currently facing. So, actually, we always track the number of councils in the regions that reduces malaria from high to low. But as I communicated in my previous slides, the number of regions with high malaria burden has been increasing, despite the fact that there is a slow reduction of councils with the high malaria burden. But the pace that we are seeing is very slow if we are to reach our targets of malaria elimination by 2030. The other message that I want to communicate, we looked at all the sentinel population, the under 5s, the pregnant women, as well as the school-aged children. We are almost stagnated in terms of prevalence reduction in all these sentinel populations. So yes, over the years we've been doing fine, but in the recent years, we need to do something different if at all we want to reach where we want to. The other challenge is on the biological threats. And here I've just pointed some few. One of the threats that we are currently facing is the insecticide resistance and also the drug resistance. It was very well said this morning. In 2018, 2019, we reported over 70% of our sentinel sites where we monitor, we do insecticide resistant monitoring. Actually, over 70% of the sentinel sites reported insecticide resistance to the pyrethroid-based aliens. So we shifted it to PBO nets, where since 2019, and we covered all the country using this new LLINs. But from this year on, we will start deploying geoactive ingredient LLINs in 2 regions of Kigoma and Shinyanga, just to make sure that we have a tool that is more efficient than the previous one in order to make sure that we reduce the burden of malaria in the country. As it was also said this morning, in Tanzania we confirmed artemisinin partial resistance in Kagera. So as you all know, according to WHO guidance, we need to take immediate action to make sure that we reduce pressure to the drug that is currently being used, the lumefantrine, artemisinin lumefantrine. So currently the country is in preparation in making sure that we deploy mitigation measures as soon as possible. So we are actually working on it to make sure how best are we going to mitigate the artemisinin partial resistance that has already been reported in one of the regions. However, good news, the first line drug that we are using, the artemisinin lumefantrine, is still effective, and the therapeutic efficacy is over 97%. However, there is decrease or delayed parasite clearance. But the 2 alternative drugs, that is artesunate, amodiaquine, and the hydroartemisinin piperaquine, their efficacy and the parasite clearance is still good. So we have alternative just in case we decide which drug to go for. The other one, I think Professor Govere will come and say it more around the new mosquito, the Anopheles stephensi. It is reported as we are actually more than, I think it's around 12 countries in Africa have reported identifying the Anopheles stephensi. We are making follow-up in 3 regions, Dar es Salaam, Tanga, and Kilimanjaro. But good news is that we have identified Anopheles stephensi in our country, and the monitoring is going on. Another thing is on the HRP2 gene deletion through molecular surveillance of malaria in Tanzania done by NIMRI in 2021. We reported HRP2 3 gene deletion, which is at less than 1%. Actually, when gene deletion is 5% or more, this one informs the policy change in terms of which RDTs to use at that particular time. But so far, we are good because the prevalence is less than 1%. Climate change, if you read the World Malaria Report for 2023, it has said much around the effect of climate on malaria transmission. I think we need to figure out more on how best are we going to consider climate change in malaria transmission, because it has a negative impact actually. We are seeing, for example, if you read the World Malaria Report for 2023 compared to 2022, actually the malaria cases has increased by almost 5 million as compared to the previous year. So the climate change is something that we need to take on board to make sure that it is incorporated in our malaria programming. Malaria vaccine, always you have to think of new tools, because whenever you start deploying an intervention, you should be sure that at times it might fail. So we should always be thinking of a new tool, and malaria vaccine is one of the new tools that has been recommended by WHO. However, in the country we haven't applied for it because in Tanzania, before we deploy or we use any vaccine, it has to go through various stages, including being registered by TMDA. So as far as malaria vaccine is concerned, all of them, because there are two malaria vaccines so far, R21 and RTSS. RTSS has not been submitted to TMDA for registration, but R21 has been received by TMDA, and they are in the process of assessing to see whether it will be registered or otherwise. So as a ministry, we are waiting for TMDA to register, and then it will be tabled before the National Immunization Technical Advisory Group for review, and then for submission to the Minister of Health for next steps. So, given the new challenges, if I would say so, we need an urgent response in order to address these challenges. If at all we want to stop, if we really want to stop people from dying from malaria, so we need to respond urgently to these challenges. But Dr. Olot said, with the current tools that we have, such as vector control, preventive therapies, malaria case management, it is possible to lower the malaria cases significantly and also to reduce malaria burden. What I mean here, the current tools that we have has not been deployed fully enough to reach all who are eligible. For example, we are reaching almost 100% all patients who visit health facilities, but we are not doing very fine in terms of reaching those. For some reason, they cannot reach the health facility. So we need to intensify community health management in order to treat whoever is symptomatic and get treated outside the health facilities. So to continue, also we need to explore more on the new tools for better malaria control and tackle any potential threats due to insecticide or drug resistance or HPR2 gene deletion. Sante kike.
Thank you so much, Dr. Samuel. I don't know, you can correct me if I'm wrong, but when I look at these numbers, it's a case of glass half full. What do you think? I think we can discuss that, because you see, there's some progress that's been made, and then there are these hiccups that really bother me. Let's call upon Mr. Shija from ZANAP for an overview from Zanzibar.
Good morning. Good morning. Habari asubuhi. Assalamu alaikum. Tumsifu Yesu Kristo. Bwana asifiwe. While they are setting the mitambo here, I just want to say a few things. I know that most of you are quite aware that Zanzibar is at the elimination stage, and we are really struggling at this stage for almost 20 years. But so far, we are still doing well, and everything is under control, but not yet to elimination. Thank you very much. I'll take you briefly on the situation of malaria in Zanzibar, especially for the last year, 2023, when we had the malaria upsurge, and all of you are aware that Zanzibar we were hit by this disease dramatically, and there was a serious consequences due to the upsurge. So you will also see the various data that we gathered, and we are going to share with you, mostly on the trend of the disease, how the disease dimensions is affecting the different population, as well as the challenges and performance of the program. So briefly, I'll take you to the introduction part, of which you'll see that we have maintained a significant low malaria prevalence of less than 1% for almost 2 decades, and we are still at the same stage. According to the survey that was conducted by the Tanzania Demographic Health Survey, Zanzibar hit 0.04% of the malaria prevalence in the 2 islands. So, however, we see that in last year, 2023, there was a significant increase of the number of cases that was significantly contributed by the